This is a clinical evaluation of Joshua, a 40 years old male presenting with right shoulder pain that began 2 nights ago. He works as a welder, reports no other chronic medical conditions, and generally feels healthy. The goal of this evaluation is to better understand the nature and cause of his shoulder pain through detailed history and clinical reasoning. Joshua, I would like to ask you a few questions to understand your pain better. When did the pain start exactly? Was it sudden or did it come on gradually over time? Can you point to the exact location of the pain? Does it radiate anywhere, like down your arm or into your neck or back? How would you describe the pain? Is it sharp, dull, aching, or burning? On a scale from 0 to 10, how severe is it now? Have you had any recent injuries or trauma to the shoulder, like a fall or heavy lifting incident? Does anything make the pain better or worse, like rest, movement, applying ice, or certain positions? Do you notice the pain more at night or during certain tasks at work? Have you experienced any numbness, tingling, weakness, or reduced range of motion in the arm or shoulder? Have you ever had similar shoulder pain before? Based on the information so far, acute right shoulder pain in a healthy 40 years old welder with recent onset and no prior chronic illness. There are a couple of musculoskeletal conditions that are most likely. The first is a rotator cuff tendinopathy or a partial tear. This is one of the most common causes of shoulder pain, especially in people who do repetitive overhead work, like welding. Patients typically report night pain, difficult lifting the arm, and discomfort during active use. The second possibility is shoulder impingement syndrome. This occurs when the rotator cuff tendons get compressed under the acromion. Pain usually worsens with overhead reaching or certain repetitive shoulder motions. This is also a frequent issue in manual labors. For testing, I will begin with a focused physical exam. I have performed the Near Hawkins Kennedy test to check for impingement, and the empty can and drop arm test to assess rotator cuff strength and function. Imaging will start with a plain X-ray to rule out bone abnormalities or calcific tendinopathy. If symptoms persist beyond a couple of weeks or worsen despite conservative care, I have considered an MRI or musculoskeletal ultrasound to look at soft tissue structures, particularly the rotator cuff. I consider that The laboratory tests are not needed unless there are red flags like fever, swelling, or concern for infection or inflammatory disease. For treatment, I have recommend conservative management at first. I would like I will follow up in 1 to 2 weeks to resist Joshua's symptoms and decide if further imaging or specialist referral is needed.